Welcome everybody. Welcome. J&B Live, Broker J3,
Dot B.
and we welcome you guys to a wonderful episode of Live with J&B. We appreciate you guys for stopping through to check us out today.
Thanks for joining us. We appreciate your support. Come on in and join us. Stop by and check us out.
Yes.
We hoping you had a wonderful day so far. We're going to go ahead and get started because it is 6 p.m. And as promised, we are going to deliver our JMB Live podcast. And the topic for today is health is wealth. We're going to tackle some of the disparities in the health community some of the health disparities in the Black community. So we're going to take a look at some of the issues that Black Americans or African Americans are facing in the healthcare industry.
Yes. And this is a very important topic today because a lot of us realize that there are a lot of disparities in regards to the Black health in the Black community, as well as insurance coverage, certain diseases or afflictions that predominantly are categorized in the Black community, such as heart disease, diabetes, and
Mm-hmm.
so forth.
Mm-hmm. And so, first of all, we want to look at preventive and regular screenings. And I know I'm recently retired, but um, when I worked for the state of Georgia, and I'm sure this coverage is going to continue, they would offer a biometric screening every year. Usually, that screening is similar to just a regular physical that you can get done if you have health care insurance and it is at no cost to you. So that's one of the preventive services that the state of Georgia offers, but I'm almost 100% certain that most insurance companies, regardless of where you work, or if you have Obamacare of any of those other insurances, that they will allow you to have that physical screening just to make sure that you're up to date with all of your tests and to take a look at your blood pressure, your BMI, some of the things that they say can prevent you from having other issues or more serious issues in the future.
Exactly,
Mm-hmm.
exactly. So we like to go ahead and just get down to it. First of all, we wanna talk about some of the different, as they say, diseases or certain things that are really high in the Black community: heart disease, high blood pressure, diabetes. Now, a lot of times they'll tell us that these are hereditary things, but they're coming down from your family, your mother, grandmother, and they always ask you these questions when you fill out those health forms.
Mm-hmm.
Anybody in your family with diabetes, heart disease,
Mm-hmm.
high cholesterol, high
Mm-hmm.
blood pressure, and you're checking these things off because nine times out of ten in our community, someone in our family has that symptom.
Mm-hmm.
Now, I personally, this is just me personally, have some issues in regards to a lot of things being hereditary. I think a lot of things are really more of a habit because a lot of times,
Yes.
think
Mm-hmm.
about this.
Mm-hmm.
Our parents, grandparents, they ate a lot of foods that cause high blood pressure, that cause diabetes,
Yes.
and so forth like that. And I think a lot of time when we follow those patterns of our grandparents and our
Yes.
parents, then we'll tend to start developing some of those same
Yes.
diseases
That is
that
true.
are caused. Because I know for a fact if we change our health pattern, if we start walking more, watching what we eat, a low sodium diet,
Yes.
which is the main thing. We complain a lot. Let's be real.
Mm-hmm.
Hey, some of this food that we go to these other places, they so bland. They
Mm-hmm.
don't have no taste. But yet at the same time, we wonder why that there's a gap in our mortality rate in regards to other races where we're at the bottom of that totem pole when it comes down to our life mortality. I think that because people are living longer these days, we should really start paying attention more to our health, which is what the title is: Health is Wealth. It's very important that we start paying attention to those things.
And I can testify that heart disease does run in my family. As a matter of fact, I have heart problems, and you can look at a person, and a person may not look like they have heart disease. They may not look like they have a diabetic. They are diabetic, but they could have that disease. So, what I want you to think about while we continue to talk about it, have you been tested lately? What diseases run in your family history? And even for me, with the heart problems that I have, they even recommended that I get tested to see if it's what traits do I have that I could have passed on to my children. So this is very important. You don't Some of it may not be as serious to some of you because you may not have been, you probably haven't been sick, but for those of you who have had some illnesses, these are things that you want to see if you're passing that illness or that sickness down to your children and to your grandchildren. If it's one of those traits that's hereditary, that's what you want to do. That's very important. I can't stress that enough. Mm.
So just from your own personal experience, Dot B, what are some of these hereditary, as they say, diseases that have run through your personal family, or members that may have died from those
Well,
particular diseases?
I'm gonna be honest. My dad died of a heart attack. So, and my middle son, I when he was young, he had murmurs. They said he grew out of it, but that's the reason why I'm going to have that hereditary test done to see if I pass that gene along to or pass that down to my children. And so, that's one thing. Now, my mom died. She was a diabetic. Now, I don't have, I mean, I think I may have had tested one time when I was pregnant with my last child, but I'm not a diabetic, but I do know that it does run in my family because I've had aunts and cousins and other relatives where that particular disease is prevalent. Yeah.
Exactly. Well, I know personally in my family, I've actually had a grandfather and a grandmother that both died of diabetes.
Hmm.
Also had a aunt that also passed away for COPD.
Hmm.
Um, and I actually have a few relatives right now that's actually still living, that's
Hmm.
suffering with diabetes, high blood pressure, and one with heart disease. So
Hmm.
these are real serious issues that's going on in our communities, and we noticed that there's also a health gap when it comes down to the insurance
Yes, it
and,
is.
and the doctors that are available to us for our community. The coverages are not the same. You may have the same insurance as someone else of a different race, but yet your coverage is not the same because of the fact that they are going by your race. They're going by history in your family. If you have you're prone to maybe getting diabetes because half of your family has had or have
Yes.
diabetes. So you're already at a higher risk. So your premium may be slightly higher, or your healthcare coverage may come with additional costs,
Yeah.
especially if you have to see a specialist.
Yeah. And what concerns me is the fact that in the Black community, there's a lot of people that do not have any type of health insurance. That bothers me, that they don't have that insurance. So therefore, you want to take advantage of if there are any churches in your area that may be offering certain screens or whatever. You want to definitely do that. And I reach out to everyone who's involved in the church and responsible for that healthcare ministry to start offering those screenings, particularly for those who do not have any type of health insurance, because we have to look out for each other, and that helps maintain your church membership. Of course, if people are healthy, and I know that the some may have the Obamacare. There are several different insurances out there now that don't cost as much as well, will offer you insurance if you're not employed or you're retired or whatever. So you want to try to take advantage of those insurances. But if you do not have insurance, I can't stress this enough. If you do not have insurance, you definitely want to take advantage of any screenings that are available in your area.
Yeah, and I think actually right now, open enrollment is going on. Some of them actually will be going on until close to the end of the year. So if
Mm-hmm.
you guys have not enrolled or tried to enroll, right now is a perfect time. Some of
Yes, it
you
is.
guys that are getting your insurance from your employer, I'm quite sure you've already received those emails, those memos, or those
Yes.
packages to let you know it's time for renewal
Mm-hmm.
in case you want to make any changes to your insurance. And as Doc B said, if you don't have insurance, go to the Affordable Care Act, go to
Yes.
healthcare.gov,
Mm-hmm.
and apply and see what you can qualify for. Because even if you do not have a job, you still can qualify
Mm-hmm.
to get some kind of coverage to help supplement so that you can find out what's going on with yourself if you're having some issues.
Mm-hmm.
Even today, I got a call from someone very close to me. I don't want to get into too much detail because right now, a lot of the family hasn't exposed the information, but a close friend of the family died today of a heart issue. So, and this person is no older than me and Doc B.
Mm-hmm.
So, that's something to really think about, when we're talking about this health issue, because
Yes.
sometimes you have to find out what's going on. We hear it all the time, especially in the black community, especially black males
Yes.
don't like to go to
To
the
the
hospital, the doctor. Oh, it's just something feel it must be gas. It may not be gas. It may be a clogged artery. It could
mm-hmm.
be something major that you're blowing off thinking it's something simple. And those checkups can really help determine whether you can have a serious issue going on.
And I'm the type of person, since I had my heart issues since they began, any little thing that makes me feel uncomfortable, I'm going to the emergency room if it's not within the time frame when I can get in to see my doctor. Because I just don't take any chances when it comes down to my health, because something could be wrong with you and you think it's minor and it turned out to be something that's serious. So I'm not willing to take that risk. And so I suggest that same thing. You know your body better than anybody. So if you're feeling not feeling up to par, you know something's wrong, then you want to get to a doctor. You
Yeah,
definitely want to do that.
exactly. And you guys, if you guys are having a symptom of anything like Doc B said, don't hesitate. Even unfortunately, I hate to say it like this, but if you do not have insurance, we all know we hate to go to the insurance. I mean, to the emergency room when we don't have insurance because
Hmm.
you're gonna look at this amazing bill that's gonna come in about a month,
Yeah.
and it's gonna blow you away. But let me tell you something. I would rather get a five
Yes.
thousand dollar
Hmm.
bill from the emergency room
Hmm.
and them tell me, "Hey, we see that you got some blockage in your heart,"
Hmm.
and
Yes.
know that something can be done about it.
Hmm.
Because had I not gone or don't
Hmm.
go, then I could find myself in a situation where I'm no longer here
Hmm.
because I didn't take that time to go find out what's wrong.
Yeah.
Anytime you have anything that feels uncomfortable
Hmm.
or puts you in a position where something's wrong with your body, get yourself
Right.
checked out.
Yes. Yes. And also, we want to break that stigma around mental health. That's another disparity in the African American community, the Black community. There's a stigma, well, there's been a stigma around mental health, but I think it's coming to the forefront now where more people are more comfortable talking about it. But if you're having any type of mental health issues, you want to get help. It's okay to have those issues and you want to talk about it. You don't want to keep that to yourself. So you want to get out there. You may be saying, well, I don't have the insurance or whatever. You just have to try to talk to someone. There's a mental health, that's a hotline that we're going to provide in the comment section that you can call if you're having some mental health issues. You don't necessarily have to go to a doctor, but there would be someone that can guide you through this process. But I really just want to say that it's okay. It's okay to have mental health issues. A lot of people have that stigma around it, and they feel like people are going to talk about them if they know that they have some mental health issues. But no, that's at the forefront right now. People are not doing that anymore.
And it's now that you bring that up, remember when we were younger, if someone
Hmm.
had mental health, there ain't nothing wrong with that person. They'll be
Yeah,
all right.
yeah.
And a lot of times it really was not all right.
Hmm.
We especially the black community sometimes seem to refuse to believe that mental health is a real issue because it is.
Hmm.
And don't think that other races are the ones that always commit suicide.
That's true.
That is not the case. There are a lot of cases where in the black community where you have schizophrenia, bipolar. People talk about the ADHD.
Hmm.
Actually, our own phones almost give all of us HDAD AD or whatever
Yeah.
because of the fact we're on this pattern now where we're scrolling,
Yeah.
scrolling, scrolling.
Hmm.
We're not giving anything enough time to actually set in. So
Hmm.
but sometimes it could be a little bit more deeper than that, and take it serious. Sometimes you have to get evaluated to find
Hmm.
out whether it could be a mental issue because
Yes.
if you have a relative that may always seem like they just "Arr,
Hmm.
and then 15 minutes later like, hey, how you doing, like that
Hmm.
nothing ever happened. That's an issue. That's
Yes.
that bipolar.
Yeah.
And it's a lot of people out there that have that and don't know it, because they didn't take that mental health serious, and that's
Yeah.
something that we really should take serious.
And we also want to remember the post traumatic stress syndrome as well, those that may have come back from overseas and that are suffering too. And you don't necessarily have to have fought in a war to have those symptoms of have that mental
Mm.
health disease. It could happen to anybody. Just anything that traumatic
Pregnancy,
that
having
happened
a
to you,
baby.
post traumatic stress syndrome. Anything that traumatic that happened to you, you could be affected as well. So
Exactly.
mainly this topic tonight that we're discussing is about taking care of yourself. Taking care of yourself so that you live a long, healthy life. We know we're not going to live forever,
I'm,
of
I'm gonna
course,
try.
but
I'm gonna try.
but we want to take care of ourselves because I know I want to see my children, grandchildren, great grandchildren, and so on. I want to see them live out their lives. So I want to be around a long time. So I believe in taking care of
Yeah,
myself.
it's something because I want to
Yeah.
share this story with you guys. It was really funny. My oldest daughter, God bless her, I love her so much. We was talking about. She just recently had my third grandchild. My first grandson, but my third grandchild. And I was telling her, I can't wait to see him, graduate high school,
Yes,
maybe
yes.
even get married and have some
Mm-hmm.
kids. And she said, Dad, you're not gonna be around when when he graduates high school. Putting my age out there, I'll definitely be almost 80. By the time he graduates high school, get ready to go to college or whatever. So but I'm saying that to you guys because even thinking that late 70s 80-year old be dead already lets you know that that's the mentality that we have right now
Yeah,
because we don't think that we're going to live that long in the black
absolutely.
community. you
Mm-hmm.
know um it's possible. I mean, we have a lot of people that's living well over 100 years old.
Mm-hmm.
We see it all the time.
Mm-hmm.
Before someone over 100, you see them on the news. Hey, Miss Betty so and so.
Yeah.
She's having a hundred and
Yes.
one birthday
Birthday
today.
party.
But
Yeah.
it's happening so often now that they're only picking people that have major milestones,
Mm, yeah.
110,
Yeah.
109 years old,
Mm,
because so many people are making it to that mark.
yeah.
So, like I might have joked with Doc V a few minutes ago, but I want to live as long as I possibly
Yeah.
can. And
Me too.
and my health is my wealth because
Mm,
that's the most important things that you guys have. I don't care if you're a multi-billionaire.
millionaire. Mm-hmm.
If you're in poor health, it's not going to do you any good.
So you have to take care of yourself. You do definitely have to do that. And another thing we want to discuss is the healthcare mistrust And we already mentioned the limited access, but we're going to piggyback off of that for those that are just not coming in and joining us. But back a while back there, I know most of you remember the Tuskegee experiment where they
Yes.
actually gave black people syphilis. A lot of people still have that mistrust where they don't trust the healthcare system, and they won't go to the doctor. A lot of them say, well, I'm not going to the doctor. A lot of them just hate to go to the doctor for anything. I know I had an uncle that passed away, and he had gangrene on his leg, and he ended up having to get it amputated. But for the life of me, he just did not want to go to the doctor. He thought it was something simple. He said it'll go away, I'll be okay. And by that time, it ended up to where it had gotten even worse, and it had got so bad they had to amputate.
Wow. Yeah.
Yes, yes.
Yeah. That same similar issue happened with my grandfather when he had to have one of his legs amputated. Well, it started with a foot.
Mm-hmm.
It was diabetes.
Mm-hmm.
Started with a foot.
Mm-hmm.
Then it was a leg. Then it was both legs. Then a year after they amputated his second leg, he passed away.
Yeah, yeah. And the uncle that I mentioned earlier, it started out as a toe. I think it was his pinky, but
Mm.
it escalated. So that's why it's so important. It's so important. I can't stress it enough that even something that you think may be minor, that you get in there and get yourself checked out. You really
Yeah,
do.
it's very important, and I want to say this because many years ago, I guess whenever you're thinking over 15, close to 20 years ago, I used to work for Emory University. I was there for about a year and a half under a contract with them, and one thing I noticed, every morning I used to go to work, I used to see a lot of
Mm,
people running and walking
mm-hmm,
in the morning when I was heading to work. Now, I'm not gonna lie, there was white people
mm-hmm,
and Asian people
mm-hmm.
predominantly that I saw. Once in a blue moon, I'd see someone black doing that,
Mm-hmm.
and I said, "Wow!" I said, "Now I know this is close to the university. Some of those people were doctors or nurses that live in that area, but it made me think about our community. We don't see people enough walking for their health. We might see a sprinkle here and there of us walking, but it's not enough. Don't wait until you're in your late 40s and 50s and say,
Mm-hmm.
hey, I need to start walking because
Yes.
my doctor said it'll be good for
Mm-hmm.
my health.
Mm-hmm.
These people I seen was like 20s, 30s, 40s,
Yeah.
50s and up. There's never the wrong time when it's in regards to your health. Walking is very good for your health. It's good cardio.
Yes.
Is good for
Yes.
your heart, which is one of the main organs
Mm-hmm.
that keep you going. So, guys,
Yes.
don't wait until a doctor tells you something is wrong for you to get your health together.
Mm-hmm.
If you're overweight, don't wait till the doctor tell you, hey, you're
Yeah.
developing diabetes, you have the high blood pressure, and don't think that is normal because my mama had it, my daddy had it, or whatever.
Yes.
Don't think it's not normal.
Yeah.
These things can be reversed. I don't mind sharing a personal story with you guys. When I was 39, they told me that I had diabetes, and they started giving me the pills. At the time I was taking the pills, I was checking my blood every day,
Mm-hmm.
sticking myself. Back then they had the little strips. They're more computerized now, but
Yeah.
had the little strips, and I'm
Yes.
checking I'm checking my blood every day, because this is what they told me, and I did it for like 3, 4, almost 5 months. And I said, it has to be a better way because at the rate that I'm going right now, I'm going to be doing injections,
Mm-hmm.
like my
Yes.
father does.
Mm-hmm.
And I said, okay, well, I can't let this happen. Now, keep in mind now this is the disparities what we was talking about, especially with your health care. Now, my doctor didn't tell me what I can do to reverse
Mm-hmm.
the diabetes, especially at that stage that I
Yes.
was
Yeah.
in. You know, he gave me the pills, told me to take these pills, and I'll be okay. May have to take these pills for the rest of my life, but I may not need
Mm-hmm.
the injection. And I thought to myself, he didn't tell me what I can do to try to reverse this, you know? So I started doing my own research to find out what can I do to try to reverse
Yes.
this. And then that first thing was, okay, well, you were a little overweight at the time. I think I was like 263. I was seriously overweight. So I said, let me start losing the weight. Let me start changing my diet. Took out the pork,
Yeah.
very high sodium, guys. Took out the pork, start drinking more water, eating more fruits and vegetables. A year later, go back to the same doctor.
Wow.
Same doctor. He said the pills must be working. He said you can stop taking the pills because we don't see any signs
Yeah.
of pre-diabetic or
Yeah.
anything. And I said, I stopped taking the pills 6 months ago.
Wow.
He said, you stopped taking them 6 months. I said, I stopped taking them 6 months ago. And he couldn't believe it. He said, well, whatever you're doing, just keep it up.
Keep doing it. Yeah.
No, almost 20 years later, there's still no signs of diabetes
Yeah.
whatsoever.
Yeah.
So these things can be reversed. It doesn't matter what you have. A lot of these things can be reversed. And again, a lot of these doctors are not going to tell you how to get rid of these things. You know why? You know why, Dr. B?
Yeah, because the pharmaceutical companies, that's how they make money. Now we're gonna put this disclaimer out here. We're not telling you what you should and should not do. We can only say what works for us. Just like for me, I know that I must exercise. I try to exercise the recommended 4 days a week, 30 minutes a day when I exercise for 4 days a week. And how I see it, I view this as my exercising or walking to live. I do this to live because I know I have heart problems. Same thing with a diet, how I eat. I eat to live. That's how I label it. So I'm very careful about what I eat. I definitely don't try to eat pork now. I will slip in a minute.
Yes.
He will tell you. I don't do it often, but I will slip in a minute. But I'm not a real big red meat eater. I eat lots of fruits and vegetables, which I always have. But like I say, I love to eat. So don't by any mean thinks that I've just stopped eating. I love to eat, but I'm just more careful as to what I eat and the
Yeah.
portion sizes. So I try
And
to control that.
and again, remember, as Doc B said, she's 100% correct. There is no money in the cure.
Yeah. Hmm.
There's only money in medication. When you go to the doctor, no matter where you go, whether it's the emergency room, your own special doctor, specialist, for
Hmm.
some reason, everything that's wrong with you, or they diagnose to be wrong with you, they have a pill for that, a cream for that, a drop for that,
Hmm.
or whatever for that. But there's nothing that they can tell you that you could do on your own to relieve those issues.
Yeah.
So
Yeah.
I'm not telling you don't take your pills from the doctor. I'm not a
Yes,
doctor
definitely.
myself.
That's a
That's
disclaimer.
not what we're doing. That's not what we're doing. We're just trying to open you guys' eyes to,
Hmm.
alternatives, in regards to these
Hmm.
pills, because sometimes those pills, think about this. Think about this. All these commercials that we see on TV about, this pill, this pill, this pill, that small disclaimer that they tell you, sometimes it's in a small print at the bottom of the screen, or sometimes
Yes.
that person that's narrating that commercial will say it real fast, may cause heart disease,
Hmm.
if you're having any suicidal
Yeah,
threats
thoughts and
and
thoughts.
stuff like that.
Yeah.
If you're taking a pill because you have inflammation in your knee, and they give you a pill, but then they tell you it may cause suicidal thoughts, or
Hmm.
may cause kidney disease or something like that.
Hmm.
Think about that carefully. Ask, is there another option, or
Hmm.
not something else I can take that won't cause me to feel suicidal, or
Hmm.
won't damage my kidney? Because they don't tell you all these things. They expect you to read the small print to find out what's going on with that medication, because these doctors are being paid
Hmm.
by the pharmaceutical companies to issue those drugs to you.
Yes. And then you have to think about as well, and you may not have paid this any attention. sometimes the side effects are worse than what you have.
Exactly.
So that's why you have to read the fine print, because you like, well, why am I taking this? I'm going to be worse off, or possibly worse off than I am right now.
Yeah.
So you have to pay attention to that. And as Broker J3 just said, ask questions. Is there an alternative? Is there a natural way? I always ask questions, and some doctors kind of get irritated when you ask questions, but this is my health. So I'm gonna ask as many questions as I like. And you have to remember that doctors, they're practicing medicine. They're
Yes.
practicing medicine.
Yes.
So therefore, sometimes you may prescribe you 5 or 6 drugs. They don't know for sure if those drugs, or which drug is really working, because guess what? They're practicing. They're looking at research, and it's probably based on the last couple of years of study that show that these types of medicine treat whatever you may have.
It's
But do
just
your own research.
it's just like second opinions when a doctor tell you, well, you can get a second opinion. You know, most people won't. Most people won't go get a second opinion. If for some of the ones that do, have you amazed yourself when you said, wow, this doctor told me this, but this doctor told me something completely different.
Mm-hmm.
But yet they're both medical doctors, they're both licensed to practice,
Mm-hmm.
but yet they gave you two different reasons of what could be wrong, or maybe two separate prescriptions of what can take care of whatever problem that you're having. So, you know,
Yes.
um, also, there are what they call holistic doctors out there
Mm-hmm.
that do not prescribe the normal medicines from the big pharmaceutical companies. They offer other medications that are more natural,
Yeah.
from herbs and so forth like that,
Mm-hmm.
that have been known throughout the ages, to be able to take care of certain issues. Because you guys have to think about this. You know, a lot of us don't think about it, but many years ago there was no big pharmaceutical company
Companies.
out there. Back in the day, a lot of people was getting aloe vera when they got cuts and
Mm-hmm.
bruises. They get the plant, the aloe vera, and they'll put the little sap or whatever
Yeah.
on that little cut
Yes. It's
bruise
for
and
a burn.
heal it
Yes.
right on up.
Mm-hmm.
But now, you know, they got a pill for that. They got an ointment for that. You know,
Yeah.
they got these chemicals that you don't even know what they are in them. So, like we said, we're not doctors. We're just trying to really open your eyes up to alternatives that can be helpful
Mm-hmm.
for you, especially in the Black community where we see these disparities going on,
Mm-hmm.
because a lot of us are unaware, and I hate to use this term, but uneducated
Yeah.
when it comes down to our own health. You know, I already personally feel like, you know, they're already looking to decrease the population
Mm-hmm.
on the planet. And
Mm-hmm.
sometimes I feel like, our community is, at least, where they want to start.
Mm-hmm. And the last thing we want to mention is, and we've talked about it briefly, is the community-driven, faith-based churches, what they're doing. Because there are some churches who do have workshops on health. There's some that sponsor events where you can come out and get some different screenings. But there are also a lot of free community-based events that take place as well, that you can attend and get tested for free.
Right. and
Yes.
and, and they do diabetes,
Yes.
high blood pressure.
Mm-hmm.
They check for a lot of different things, and as Doc B said, they're free.
Mm-hmm.
A lot of these community-based churches, they do that. So when you see that they're having that,
Mm-hmm.
hey, feel free to stop by and go by, because if they have a free prostate screening, especially for you
Yes.
guys, or
Yes.
mammogram screenings for
Mm-hmm.
you women,
Mm-hmm.
take advantage of it, especially if it's free. They're trying to get our community involved in their own health. Take advantage of it.
Yes. 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 Okay, so feel free to chime in and let us know. Of course, post in the comment section if there's a screening in your area or something that our viewers can take advantage of, because we have to look out for each other, and to make sure that we're all taking care of ourselves. That's very important.
Yeah,
Very
so
important.
we definitely want all of, our community and everyone else, not just the Black community, but
Mm-hmm.
everyone else.
Mm-hmm.
This particular subject today
So,
was in regard to some of the disparities that we have in the black community, but we care about everybody's
Everybody.
health, not just the black community. It's just that we know that from the numbers that we look at, there's some serious issues going on, and we just wanted to address that with the black community so they are more aware of what's going on. We appreciate you guys stopping in with us
Yes,
today.
thank you
You
so
know,
much.
very, very good
Thank
topic, and
you.
we appreciate you guys
Yes.
asking us to talk about that because, when it was brought to our attention, we wanted to check it out, and
Mm-hmm.
and we realized that it is a serious topic
Mm-hmm.
that needed to be discussed. And as always, we let you guys know J&B Live is interactive. Is we do this for you guys.
Mm-hmm.
So, always remember to chime in. Let
Mm-hmm.
us know what's going on. If you can't always catch the live on
Mm-hmm.
Tuesdays and Thursdays,
Mm-hmm.
feel free to go back to our YouTube page,
Mm-hmm.
live with J and B, and comment
Yes.
or send us a message and let us know how you feel. We appreciate you guys all
Yes,
the
we
time with the
do.
likes that you
Thank
give
you.
us, but we want you guys to comment. Please
Please
comment.
comment. Mm-hmm.
Even if it's just for a sentence or two to just let us know that you love the content, you appreciate us talking about subjects that you ask us to talk about,
Yeah.
or if you're watching one of the past episodes and something touched you, or you wanted to comment to let other viewers
You know.
know something in regards to that subject that you may have experienced. That's what we want. We want this to truly be interactive with you guys.
Mm-hmm.
Soon we're going to start doing our live panels. We're going to give you guys a chance to come on up and talk with us in regards to the topics that we'll be
Yes.
discussing. So we really look forward to it.
Mm-hmm.
2025 is really going to
Mm-hmm.
be live. We're so
Mm-hmm.
excited
Yes, we
about it,
are. We are.
as we're winding down to the end of the year. So guys, we thank you again
Mm-hmm.
for joining us.
Thank
I'm
you
Broker
again.
J3.
I'm Dr. B, and thank you again. Thank you for your support. We really appreciate it. So we can see the topic stuff.